All right, so we are officially live. Sorry, everyone, that I am late. I had technical difficulties of getting myself on, but we are all here. So I'm going to have everyone to introduce themselves. I'm going to start with Kamaria. You can go ahead and go.
Hey everyone, Kamaria Laffrey. I use she, her pronouns, and I'm based in Polk County, Central Florida, and I'm the co-ED at SERO Project and the coalition coordinator for Florida HIV Justice Coalition.
Mhm. All right, Tonio, you can go next.
Hey everyone, I'm Antonio Miles. I am the Executive Director of Evolve Tampa Bay here in the great city of Tampa.
Okay, Tori.
Hello, everyone. I'm Tori Samuel. I live in Ocala, Florida, and I am a Florida HIV advocate.
Okay, and Emilio.
Thank you, everyone. Yes, Emilio is my name, Emilio Apontesierra-paretti. And right now I am in my home in Palm Beach Gardens. And I mentioned that because I work for High Impacto and my office is in Fort Lauderdale. And also I do something in Miami. So I am in South Florida.
Okay, awesome. So what I have here is basically I want Kamaria, if she doesn't mind, since she has been advocating about it since the change, well, technically before the change, the explanation of the Florida AIDS Drug Assistance Program income requirements.
Yeah, I'm gonna try my best to keep it short and sweet. But the income, and please, anybody jump in if I characterize anything. But the Florida AIDS Drug Assistance Program was supporting folks who are on the federal poverty level of 400%. There were three major changes that happened, so I'll just name that because those are things that we're going to be talking about tonight. The federal poverty level changed from 400% to 130%, which is roughly about $20,000 plus a year, which no one can truly survive off of and afford their medication. That was one of the changes that happened. Another change that happened was the formulary that allowed certain prescription drugs to be approved and covered by Florida ADAP was removing one of the most popular and beneficial drugs, which is Biktarvy. So it was taking that off of the formulary. And I think the third change was around premium assistance. So that was also being impacted. People who had like marketplace insurance are no longer able to have their assistance premiums supported or covered. So that's kind of like the quick and dirty of the income requirement changes around Florida ADAP that went into effect March 1st. The additional part of that is our House and Senate just voted this Wednesday, to approve what we call a stopgap measurement, which the only change that happened was that the federal poverty level went back up from 130% back to 400%. It still does not cover Biktarvy, and you still cannot get assistance with your drug assistance premium assistance for the drug assistance program. And there's certain other programs that are not able to support you depending on what type of insurance you had before.
Okay, so a follow-up question about two things. You mentioned Biktarvy. So I have no reason to take PrEP. Duh, no, positive. But so is Biktarvy also used for PrEP? I don't know what drugs they use for PrEP. Is that one of the drugs actually?
That's a good question.
You don't know?
I can jump. Can I jump there?
Yes, please, Emilio.
That is a great question because people think, oh, that person is taking that medication is HIV positive. No, there are medications that people who are HIV positive take, like a Biktarvy, but there is another, like Descovy. So Descovy taken with all their medication is for treatment. But if the person who is HIV negative take Descovy, that is for prevention, and that is what we call PrEP.
Okay.
Also, before Descovy was Truvada. Many people think that Truvada, but Truvada has so many side effects, and Descovy is better than Truvada. That is why people are taking Truvada as PrEP oral, but there also are injectables.
Okay, yeah. So, and also the other question is, well, for an example, you mentioned the income level. So for me, I'll make about $38,000 to $39,000 a year. So that means that I would have been cut if I live in Florida, basically.
Yeah. You wouldn't qualify for ADAP, for
Correct.
premium assistance, or for ADAP in general.
Hmm. And so this is so far. This is the only state so far that we know of. That is doing it or has happened
This is the only state that's done this in this way. There's other
in this
states
way.
that are at risk, all right, are assessing before their next session. Every state's different. I know things, but they're not confirmed, so I don't feel comfortable saying them publicly just yet.
Okay,
Yeah.
understood.
But there are other states that are in development of trying not to do the same thing Florida did, but they have other ways of how they're trying to cut access because ADAP is considered a government assistance program. So our current federal administration wants to take those safety nets away from people because they think that they're wasteful.
Well, which I kind of find hypocritical and just, I would say, evil, considering that this current administration, this first term, they had the thing of, was it in the HIV epidemic? There was their ordeal by, was it 2030? And now they're back in office again, and now they're doing this. So
Yeah.
I find that very just mean. Um, So, are there any other key points that any of you guys wanted to mention regarding the change?
Sure. I like to add to what Kamaria was saying. For those folks that were kicked off of ADAP or terminated from ADAP, the only way to be able to maintain like their ADAP status, if they didn't, or if they did make more than the 20,000 and some change a year, is that they would have to obtain their own insurance. So either finding out how to pay for it themselves, finding an organization that may be able to assist paying for it, or to just go uninsured and just figure it out on their own. And unfortunately, there's quite a bit of people that are figuring it out on their own.
No, that's tough. That's just crazy. I can't imagine being in that state. I'll explain my story later. What I did was last year with insurance. But anywho, this is about Florida right now. So for the ones, Tonio, you mentioned that this has somewhat affected you. Could you explain on how this change has moved you personally?
Absolutely. I work as a case manager for Metro Healthy Community, so it has affected our workload for sure since this news came out very abruptly. So we have called hundreds of clients to assist them with switching from the insurance plans that they were on with ADAP to something that was more affordable for us to be able to assist with. That was successful for most people, not successful for everyone. So also just having to, break down to people exactly, what does that mean to not have insurance, right? What is covered? Can I still see my provider? So dealing with those emotional stresses of this information and possibly being uninsured and not knowing what medication do I still, stay on my medication? What does this mean for my provider? So many things have arisen with this information, and people are honestly scared. So dealing with that on a day-to-day basis is, even stressful just to deal with, for myself. So, yeah.
Mm-hmm. All right. And Tori, how has this affected you personally?
Personally, this has affected me because I, living with HIV, I've been on the ADAP program for 2.5, 3 years now. And I'm currently on Biktarvy. So being on Biktarvy now for 9 years, I don't want to change my medications, of course, because I've had no side effects with this medication. So they're pretty much telling me I have to choose between a generic or get on something else that could possibly, I've taken other HIV medications that have caused me really great side effects to my kidneys and to different areas. So I don't really want to play around in that area. And piggybacking off of what Tonio and Kamaria were saying, me and my husband, I have a family of 4. Me and my husband, and I have a set of twins that are 12.
Mm-hmm.
I work and my husband works. So with our income, just like Tonio was saying, I think between me and my husband's income together, we were like at $65,000 a year. So when these changes came abruptly, I was working a part-time job at FedEx in the warehouse. I think I probably was making maybe $17.89 an hour, 20 hours a week, part-time now. Even with that small amount of money, my case manager told me I was 3,000, I believe his exact words, $3,300 over the FPL once they lowered it.
Yeah.
So me and my husband made a decision. I'm gonna step away from FedEx and just completely stop working. And we're still over. So it's like you said, it's just completely unfair for people that are trying to work. We have bills to pay. My husband has private insurance, but it covers him and my kids. With my HIV, they don't want to cover me at all. So right now I'm trying to figure out how we're gonna what different patient assistance programs. I'm blessed to have a doctor that did write me a 90-day subscription supply. So I do have access to my Biktarvy for 90 days, but I'm trying to figure out what am I gonna do afterwards because I don't want to switch.
Mhm.
And even programs like Medicaid, I could apply for Medicaid, but by me, my husband working, we automatically don't qualify. So it's like a no-win situation, and it's just really frustrating trying to try to stay focused, it's like I'm getting punished for working and want to provide for my family, and it's like I just don't agree with all this stuff at all. It's just
Of course,
crazy.
I mean, no one in their right mind should be agreeing, And do y'all happen to? Of course, I tried to research it on my own, but I didn't get a clear answer like I wanted it. Why did the funding was affected? Like, what was the reasoning why they cut or decrease or misuse whatever funding? What's wrong with the funding exactly to why it's not funded?
we
I
Go ahead, come on.
Go ahead.
that so there's so much because Tori just reminded me like three other things that I need to address. There's an alleged budget shortfall that the state of Florida, the State Department of Health has claimed, but they haven't proven adequately with real math where they're getting their numbers from. I'm not a data and numbers girly, but I haven't seen the budget. Advocates have been asking for an audit since September of last year for 2024. And the decision that was made was solely based off of the 2025-2026 fiscal year. And the changes that went into effect that only the FPL goes back to 400% is only in effect until June 30. So
Right.
come July 1, we are back at square one. So this budget shortfall, I have no idea what they're talking about. And the money that they appropriated for from now until June 30 is only $30 million. So I don't know I don't know how sustainable that is even in that short window of time.
Yeah. And
Can
honestly,
I add?
yes, go ahead.
Yes, Kamaira mentions something very important is we don't know the budget, right? But there is something more deeply there. So ADAP is facing this significant funding shortfall because they cannot afford to pay the insurance premiums. But why? So the federal program, ACA, that people call Obamacare, that had a tax credit. So the government didn't approve continuation of those credits. So when that happened, so the premiums amount is higher and the health insurance can do whatever they want. So because now the premiums are so double, if there were people paying zero in ACA, now they are paying, let's say $70, and they cannot afford that. So the shortfall that the ADAP suffer is because the premiums are so high and the money that they have cannot afford. So what they decide is cut and don't pay more premiums. So that is why they don't have the money. I don't know how much, but the thing is because the government decide not to approve the tax credit, and the health insurance was all over the roof.
Okay. So my next question was like, what will y'all think will transpire? I would say after June or July. I'm hoping that, let's say in Tori's case, married, she stepped away from your job, but it should be to the point to where just to survive, let's say, I'm not speaking this into your life or anything like that, Tori, but y'all got a divorce only just because you can get treated.
And that's, and it's sad because not in my situation. I've had a lot of other people, because before I was working at FedEx, I used to be work for the Alachua County Health Department, and I worked there for 9 years as the regional linkage coordinator. So I still have a very good relationship with a lot of the people there. These people are completely blindsided right now. I know me and my husband are trying to work out a plan, but a lot of people are just completely, it's in chaos right now in Florida. A lot of people don't know what they're going to do. A lot of people aren't as vocal as me and a lot of other advocates. So they're just going along with whatever they're being told. And a lot of people, if they don't have access to their medicine, they're going to stop taking it. And I don't think that the government realizes that. They think that they're saving $120 million, but if 16,000 plus Floridians go without access to their medications, the viral loads are going to shoot through the roof. Emergency room visits are going to shoot through the roof. So it's more money that they're going to be putting out versus what they're allegedly trying to save. I believe personally they're trying to do population control, because it just doesn't make sense what they're talking about. And when we keep trying to get answers, and it's like, and they're not really talking about what this $120 million was, what the saving is going to be for. And it's just, I just really fear, not just for myself, but just for so many others. I've had people reach out to me. I had a high Haitian Creole population. They weren't even getting if they did receive letters about these ADAP cuts, it was in English. For one, they couldn't understand it, and a lot of people did not even receive letters from the. So it's just like, it's just completely chaotic right now, y'all, and it's really sad, because it shouldn't have to be like this. And people should be able to have access to their medications and without having to fear about, just like Kamaria said, this is just till June 30th. You guys know we blink 3 times, June 30th to be here. Then what?
And I want to be clear, whenever people are reading this in the media or they hear someone talk about it, I want to be really clear when we say the state, that we're being clear that it's our State Department of Health that's making this, that made the decision. It's not the legislature. The legislature didn't decide to do this. They actually fought for us to be able to try to turn things back as best as we could. They're scratching their heads, asking the same questions we're asking. And I think that's really problematic. There's a lot of things going on with, you can see it nationwide, of cuts to public health. When Tori mentioned about having to switch medications, that's putting people on a forced non-medical switch. And the only way you would be able to get back on Biktarvy is if you go into, like, a provider determines you've gone into renal failure. So you got to wait till I'm damn near dying to put me back on my medication that was already successful for me, because you've decided that I'm too risky and too expensive to take care of. That's what our state health department, the conveyors of public health, that's what they decided for people living with HIV.
Yeah, and I'm worried. Again, I'm not in that particular southern state, but I think about what I went through nearly 10 years ago with HIV criminalization, and I'm wondering, hoping that does not spike.
Well, I hope it doesn't spike either. And I say this with a lot of rage, and I'm so upset. Like, I'm trying to hold it together. So I didn't say this to the people on the call Wednesday, because when we have our small wins in this political climate, we deserve joy. The fact that our legislature fought for us is a win. The fact that we got a temporary pause on this is a win. So I didn't want to poo-poo on people's wins. But literally, as I'm on the call of us celebrating, I get a text message from another board member from the SERO project from another state that alerted me to let me know that a woman in West Palm Beach was just arrested for alleged non-disclosure. Then I get on another call, today's Saturday, so Friday night, yes, last night, I get another text from someone in another state, and I saw on social media that North Florida has an arrest of a police officer
Yeah, I
that
seen
was
that.
arrested for a non-disclosure. I am not a conspiracy theorist, but I was saying from January 12th, when we found out about this, I was like, criminalization rates are going to go up. Criminalization threats, the threats are going to increase. And this is the work that SERO Project does. So when I started seeing this the day that we got this stopgap measure, I was like, no, this cannot be happening. This cannot. Also, just for anybody listening, the Florida HIV Justice Coalition's, I think we've only skipped 1 year. Since 2015 has introduced language to our legislature to modernize the statutes. Right now it's considered a felony for non-disclosure, and that's not what this call is about, but I just want to talk about that because as soon as I heard
Go ahead and talk about it.
As soon as I heard about the forced non-disclosure, as soon as I heard about people being sent letters to their house, which is forcing disclosure, you don't know if people are in transitional housings because they're on probation, they just got out of jail or prison for something maybe not related to HIV, or it might be. You don't know if someone's in an intimate partner violence situation. You don't know what the situation is where you're sending these letters, and you don't know who's opening the mail. And so you're putting people living with HIV at risk of not having autonomy of how they disclose. When people do what they're supposed to do according to the statute and disclose, they are putting their lives at risk. There are people who have done everything to the letter, to the T, and have lost their life because of it, because people don't understand. So you have all these implications and intersections of stigma, of fear, of misinformation, of violence. And trying to get the state health department, the conveyors of public health, to understand this, that all the decisions they're making impact our lives, is super frustrating. And what I fear, and y'all, especially y'all who know me, know I'm a chronic optimist person. Like, I'm always finding the silver lining, but I'm also not the woo to fool, and I don't trust the government. I fear and I worry that at the end of this, when the HIV transmission rates increase, when HIV criminalization increases, people living with HIV, as always, are going to be left to blame. We're going to be at fault for this.
Yep.
It's going to be our fault. It's not our fault. We didn't decide this. We didn't choose this. We're trying to stay healthy and live and not have to beg for permission to thrive and function and be healthy. And that's the calmest way I can say all of that. So,
yeah, I want to add something because, Kamaria, you say this call is not to talk about HIV criminalization.
but it is.
But you know what? It is. And you know why? It's not just only for Florida, it's the whole country. So ADAP belonged to Ryan White. And Ryan White program is a program federal, the government. And the decision for that program to continue is there in the Congress. And the local state are the Florida Department of Health, in our case, manage Part A and Part B of Ryan White, and there is where ADAP is. So the government from the federal also have to do something with us in the state level. And the good thing in the state of Florida, and we have to mention that, is that they did make the bridge, and we now have some way to breathe until June 30, thanks to, like you, Kamaria, and many other people who went to the state of Florida and fight, thanks to other organizations, HF and all of that. So, but what happened when ADAP changed? ADAP changed absolutely, create conditions that make criminalizations more likely to happen. To happen to who? To Black and brown communities like us, LGBTQ people, immigrants also, people in poverty. I don't want to mention Tori, but you right now, you mentioned you have no money. You are there. People who listen to this. People who lose vital suppression due to the cost insurance. There is the point, because losing insurance can make it harder to stay in care. When ADAP stops paying the insurance, some people, what happened? Lose access to their regular doctor, have trouble getting medications, miss lab appointment, no more lab appointments. So fell out of care. And what happened with that? The stability is affected. And what happens when the stability is disrupted? It can make people more vulnerable. People in other part of the life, like a law enforcement. So right there is the link that is happening, because Florida, as you mentioned, Kamaria, we have law that criminalize HIV. Florida still have law that were writing before, when we understand EU equals EU. Those laws has been not updated. Even we know treatment works. People with an undetectable viral load can now transmit HIV. HIV is a manageable condition. Knowing that science, the Florida law is still old and outdated. It's not aligned with U equals U, is not aligned with anything. So when ADAP has destabilized someone's care, the risk of being criminalized goes up, even though the law maybe it's not being changed. It's the same law. But people living with HIV become vulnerable, and that vulnerability increase. And you know what also? There is that the connection becomes real when people lose the insurance, the access to medication becomes the viral law is not suppressed, right? So remember, if the person doesn't have the labs, the person is out of care, they cannot have the potential proof if they get arrested. Because if you get arrested and you prove you are undetectable, you have a case to win. But if you have no lab, you have no doctor's appointment for a year or for whatever, how you are going to prove you are undetectable? So yes, today's conversation is about HIV criminalization.
I just want to say something really quick about proof and things of that nature. The first thing that SERO Project tells people, when people living with HIV reach out to us about the threat of criminalization or they've experienced this, we tell people to shut up. Like, don't talk to law enforcement. Don't talk to the detectives. You are not supposed to try to prove to law enforcement, because they are solely operating off what the statute says. The statute doesn't say blip about protection or proof or anything. So offering that information goes into the prosecutor's arsenal to then subpoena for your medical records to see when you weren't undetectable. And then they go on a hunt to see if there's anybody else that you've been with that could possibly say. That's not every case. I'm just saying, whenever we find out cases are happening, like I want to reach out to this woman in West Palm Beach, the law enforcement officer is going to be a little more tricky, because even his headline read differently than hers did. His says allegedly didn't disclose. Hers says she did not disclose.
Oh,
and Kamaria, I want to post this comment real quick.
Sure.
Someone mentioned about they were the comments beneath the post about the police officer who was arrested in North Florida. It's evident some individuals remain poorly educated and perpetrating stigma at a higher rate due to misinformation. Well, I mean, that's expected. It's like deja vu triggering, because that's what happened to me 2017.
Wow.
When I got arrested, someone told me, well, the guard inside the jail told me my mugshot was all over Facebook. That's how I figured out all my stuff was on social media. She told me, which was kind of professional. Should have never told me that, but whatever. But that happened, and yes, I read the comments. I never should have, but I did, read them, and of course, they were ugly comments and stuff like that. And I mean, nearly 10 years ago, and even now, people still ignorant. Unfortunately, I'll say, and this is not to make it a race, because again, I'm more connected with people, of my race, but I've seen a lot of unfortunate miseducation or uneducated or foul mean comments from our people when this issue affects us the most. So this is something I found, just disheartening when it comes to comments. It kind of keeps me, away when it comes to, I would say, trying to educate people, because again, people, you can tell with certain type of people there, they don't want to hear it, or they just stuck on what they grew up on and, what they believe in or whatever. So it is disheartening.
The fact that it hasn't happened to them, like
It
they're
hasn't happened to them yet.
they're throwing out judgment based off of perceptions that they're not even living in.
Right.
Mm-hmm.
Correct.
Yeah, and I'm grateful for people, especially who were intelligent enough to think, especially when my case happened. They were able to think and, like, no, this is more to the story than what it was presented as, on how, the how it was presented, like, to the law, how language is important, especially when the laws are made, because again, it was put out there, I exposed someone, to HIV, but people think that I actually infected someone, stuff of that matter. People automatically thought them, like, no, that was never the case at all. And then Kamaria, you mentioned how far as, mentioned the police officers, they don't care about, the treatment or, prevention and stuff of that matter. During my case, the prosecutor, of course, got a hold of to my medical records, and was trying to pinpoint, when this incident happened. But they was looking at this other date, like, well, he was undetectable here. I'm like, that has nothing to do with it.
Mm-hmm.
And people don't understand that there's various reasons why someone living with HIV who's on their treatment, the labs that Emilio is talking about, periodically our numbers dip. It's an immune system issue. Like, your immune system changes based off of tons of variants throughout your day, and then throw in COVID, which we've been living through for the past forever, it feels like. And so our immune systems are literally fighting and adapting. That's what it's doing. So having your medical labs being subpoenaed, and then, like, trying to find a history of you not being undetectable, for a prosecutor, it's like, oh, well, then this is when you must have been trying to give it to someone on purpose, because that's their argument. That's what they're standing on, because the statutes don't uplift the fact that it doesn't talk about intent. It doesn't talk about proof of disclosure, and intent can be factored in. Let's say I'm not undetectable. The fact that I'm on my treatment means that I can't be intending to give anyone anything. If I'm on my treatment and use a condom, I can't be intending to give someone something. But the argument also goes into, like, how do you prove intent? How do you prove disclosure? At what point, when you talk about disclosure, at what point? There's a whole training I do about this. So I'm trying to all the time about, like, the different factors of proof, because I don't want to make people think like you're just helpless. You're just out here, like, with no peace of mind. Save every piece of document. Save everything you can. Have a backup of the proof, but just know that may not always save you in court, and don't give it to law enforcement. They're not the ones you need to be proving it to. They're unfortunately doing their job based off the statute. The proof is for the court. The proof is for your attorney. That's why there's organizations like SERO Project, Center for HIV Law and Policy, otherwise known as CHLP. Each state has, like, a coalition. That's why we exist, to help get you connected to folks. We don't offer legal support because that's expensive, but we do help you navigate the system. I mean, I met Sanjay at our training academy, HIV is Not a Crime Training Academy in Indiana. And that's where we learned. Actually, we didn't even learn about you, Sanjay, till after you left. You came to the conference and didn't say a word, literally did not say a word.
No, because I was in a not a euphoria state of mind. It was a mindset still of shock still. Me just still trying my best to move, just move in general, fly here. Because that's honestly, that was my first time flying ever, was when I was in
Wow.
first time ever.
Baby boy, I didn't know that. Oh my God.
So having that experience was nice. I was able to, grab hold to that. But as far as my mental state, Kamaria, I don't even remember you being there, because my mental state, like I don't remember a lot of things. No, I remember hugging Cindy. That was the first thing I remember doing arriving there, was hugging Cindy. I barely remember meeting Tammy, but I remember her face. But I cannot remember you, because again, Robert, he mentioned, Robert Soto. I think we had shared a room on campus. He mentioned I was sleeping, like I was actually depressed. I didn't realize that I couldn't remember.
Very once. So being on staff, once we got back to like do our debrief, Robert shared, it's like, I got permission to share this with you all. And Cindy was talking about it. And I distinctly remember where you were sitting. You had your headphones around your neck. You had just taken them off when I walked past you. And I could see in your face. I was like, oh, I'm glad you're here. Because I think I was checking in with you. I was checking on first timers. That's what I was doing. I was like, oh, is this your first time? Thank you for coming. Like, I was doing what everybody knows I do.
And I remember it all. I was so much under stress, because actually, was it just a day later, 2 days later, I had court that week as well. So all of that still transpiring, just everything. Like, it was a awful period. I don't think, I was still working my job at the hospital then. But that experience, my first high neck, was horrible, because again, I couldn't remember. Like, honestly, I cannot remember at all. I remember arriving there and meeting Cindy. I mean, we went down the street. We ate at Pizza Hut. It was like a Pizza Hut place down the street. I remember going there, but actually attending the actual workshops, like I've been doing like the past 4 years, I could not attain. Like, it's just like, this
also,
stuff affects me bad.
For you to have been at that, anybody who doesn't know about HIV side of
Oh, well, I do remember Bully the day before High Neck. I do remember everyone being there.
Oh,
So
yeah.
I was in there the day before. They had Bully the day before High Neck started. So I do remember arriving there, and me actually experiencing, just seeing all types of Black people, trans, straight, in age, younger, just everyone was there, was Black in every walk of state of life was there. So that was a new experience for me too as well. I do remember that. And I was in Robert and Keon was facilitating, the meeting. I do remember that. But anything, Kamaria, I don't remember meeting you there.
That's okay.
No,
I say that because I'm like, you're a board member now. Like, okay, you don't remember meeting me, but now, like, that was also 10 years ago. And I would love for you to, like, since we've talked about the outcome of like what state violence looks like on an individual, I would love for you to share like how far you've come and like what the outcome of your case was. Like, you're not in prison, like you're free essentially. So I also want people to like know that there is hope. There is a way out of it. It's just really connecting to networks and other folks that have access to the resources. And I'm not just talking about money for attorneys. I'm talking about the education, which is why we have HIV Exotic Crime Training Academies for people to come get the information, which is why it was shocking to hear that you were going through it while taking in a lot of hard information at this conference. Like, I work at SERO, and I don't think there's a single high neck I've been to where I haven't cried, because I'm just like, this shit is hard. Sorry for cussing. I was like, this is.
You're welcome. Please cuss.
Don't give me permission.
And honestly, I didn't cry. The only time I cried was like 2 days after, of course, high neck. After the hearing of the court, I came home and just broke down. But other than that, that was the only time I ever like cried. During or being criminalized and stuff like that. But yeah, that was very much of a hazy conference, but the last two in Virginia and North Carolina, I was so glad I was able to obtain and just take in all of the moments and just classes and sessions I'm able to remember now. That's what I'm happy about. I can remember now. So I'm grateful for that and being in contact. But moving forward, so we mentioned about all the things that could transpire, has transpired that y'all have seen, especially in Florida with this, spike of people maybe getting criminalized, unfortunately. Are there like any organizations? I know y'all mentioned that one of the senators, I think his name is Smith.
Yeah. Senator Carlos Guillermo Smith.
Yes, I don't want to pronounce the name. I don't want to get it wrong. But yeah, I've seen him on social media. I was like, oh, he's really fighting for, his state, basically.
Mm-hmm.
Even though it's a temporary fix, I'm hoping they can redo their funding or audit findings and still, proceed with getting care, and no one has to do any hasty things just to survive or reacting out of fear. No, that's right.
Go ahead.
Go ahead, Tonio.
I wanted to say, I think it needs to be said that, these legislators are not fighting for people living with HIV only, right?
Mm-hmm.
They are fighting for every Floridian, because this is a community health concern, right? Which can turn into a community health crisis, right? Because going to what Emilio said, the science behind undetectable equals untransmittable, knowing that, medication that people living with HIV have been taking or are currently taking reduces or completely reduces the possibility of contracting HIV to other individuals that are negative is super important, because if this continues on and there are, of course, increasingly more people not taking medication, not going to the doctor's visits, not doing the labs in which Amelia was referring to, it is going to immediately impact communities of color, but not only communities of color, it's literally going to impact everyone. So I think that miseducation, that misunderstanding, and the stigma around, HIV being in specific communities, we know that people are out, living lives and, being adults or what have you, with various populations, right? Even more so today than maybe 20 years ago. So it is not a centralized thing, but we do know that it will begin to affect, communities of color, and people that don't think they're at risk, right? Or some of the people that are making some of these comments, under posts that they may be at risk. So there's a lot to educate, and I don't think we'll be able to educate fast enough. But it is important to know that these legislators are fighting for every single Floridian, not only people that are currently living with HIV.
Mm-hmm. And also to mention, I believe it's in Florida, or if it's anywhere in general, but in Florida right now, a special enrollment period, I guess for insurance, I believe, correct, Kamaria? Or a form of insurance? I don't know if I'm sure. It does end April 30th. So the last day is the 30th of April. So I'll find a link, or someone can send it to me so I can post it after this live is done. I can post it, within the caption, basically, so someone will see it.
The special enrollment is through ACA. So whether you're on I actually don't know if you're already on ACA, you qualify, mm-hmm. but you may not be able to get on a plan that your provider's on. Like it's a special enrollment period that's like individualized. Like you really have to talk to an insurance broker and have them mm-hmm. walk you through like what you're eligible for. And I would encourage people, when you do that, I don't know of a link, I just know of a phone number, and I don't have it right now. Mm-hmm. But I would encourage you to have written down what all the medications you take, who's your provider, and what providers you want to prioritize. That way they can find a plan that holds all that. If you don't know those things, you might end up getting put on a plan that may be more affordable, that will get you what you need temporarily, but you may not be able to see your provider may not be in that network anymore. So I would encourage people to make sure you know what's important to you, that you want covered, that you cannot take care of during the special enrollment period. So that's really, I'm actually still navigating that myself. I have ACA insurance. I don't qualify for premium assistance.
Mm.
And so I'm trying to figure out, do I want to leave my plan and try to find someone else so I don't get stuck on this if I end up getting kicked off my insurance? It's like Tori said, it's absolutely chaotic. Really trying not to cuss.
I don't like being this is stressful just talking about healthcare in this country, and this is I'm like I really got born just to deal with this crap.
I'm glad that you asked about this. I'm glad that you asked about the special enrollment period because that is important for folks that are seeking insurance to be able to be eligible for ADAP, right? And I think going into it and people really not maybe enrolling themselves, maybe having somebody else enroll them, or having ADAP enroll them and having to do it themselves now, it can be very daunting, right? Like, how can I afford that? Working as a case manager, I have assisted many people in seeking, some insurance that is affordable. So, there is affordable insurance that, can cover, doctor's visits and have low copays and low premiums. It may be more than obviously what they can afford, but, some people can find some, $0 copays, things like that. So it gives people a little bit of hope to know that there are some decent and affordable plans out there. But I would encourage everyone, if you don't already, to talk to your case manager, because just navigating, even calling the marketplace can be a thing, right? I've called them and this person knows one thing, the next person knows another thing, the other person says they don't know how to do it. So just that can confuse people and frustrate people so much to where they don't want to deal with it at all. So I encourage each and every person that is going through these ADAP terminations to connect with a case manager, right? That can better help navigate that system, and to also kind of be that reassurance of making sure that you have all of your medications and that your doctor is covered, because you may not know if your doctor will be covered, but they can look into that information for you. So that is something that I absolutely encourage people to do. Connect with a case manager agency if you aren't already connected, or go ahead and call yours up that you already have.
You're right, Tony. So I want to add something, because as CPO of High Impacto, the chief program officers, I oversee all the programs in High Impacto, and we had a program now. And I don't want to sound, I am advertising, okay? No. But what Tori say, what Kamaria say, what Tony you mentioned right now, say, oh my God, probably I can help you guys. You know why? Because in High Impacto, we work with the concept of neutral status. What that means, we address the individual as a person. Doesn't matter the HIV status. But one thing under one program that we implement is for HIV prevention using PrEP. But because we address the individual who asks help to High Impacto through the neutral status, what we do is we have to find out your HIV status. And accordingly with the result, we're going to provide the help that you need. So if the individual, the lab result is positive, or the person is already positive, they come to us and prove just to, you know what, this is the medication I take, I am positive, this is the result, blah, blah. Okay, no problem, come in, you are welcome. So, and the problem that we are working now is a system to access to health insurance. So right now we are working with ACA. So what I am listening to Kamaria, you say you have it. Tori, maybe, I don't know exactly which have. And I don't promise I'm going to help each of you, because as you know, each case is different, is unique. But the good thing is we always try to get the health insurance for the individual to cover the medication that they need. For example, this is for PrEP, and they don't want to take Truvada because whatever reason, or they don't want the injectable for whatever reason, they want Descovy. We find the health insurance plan that covers that particular medication. And we pay the premium, monthly premium, and we pay the copay for every medication related with HIV. for prevention as a treatment or prevention as people without HIV. So what we are in this process, many individuals who are affected directly for ADAP, they contact me and they show the letter that you were talking about, Kamaria, that the health department sent out to the houses. I saw one, I have one in my hand and said, oh my God, these letters are coming to the houses?
Okay.
Come on. So, and they say that, and I said, look, we can help. I'm gonna hook up you with a broker or health insurance agent, because we don't have that, because we are not a health insurance company. But what we do is we hook up the individual with the broker and work very close. And accordingly with the case, the broker can say, you know what, this health insurance is good for you. Okay, so and that when we find the health insurance is good for the individual, we make everything possible to provide or to enroll the individual. Before was a problem because the open enrollment finished started in November and finished in December. But now because ADAP problem and this temporal and fixed, they open a special open enrollment to April 30. So everyone who have affected by ADAP can apply for that.
Okay.
So, and I am thinking, I have not established this in the program yet, but I'm sure I can analyze each individual with my staff and find a way to help the HIV people, the people who are living with HIV. And something interesting that you mentioned when you mentioned the medication Biktarvy. So ADAP is not paying health insurance. And also they remove Biktarvy from the list. So if you have health insurance and the health insurance may be covered, but ADAP doesn't cover, so you cannot have Biktarvy.
Okay.
So if you get a health insurance who cover Biktarvy and your doctor, the one you have right now, is under the network of that health insurance, you can continue with your doctor. So you take the Biktarvy, you have your doctor. But that every case is different. So please, let's talk after this for you guys, Tori, Kamaria, to see how we can do that. And that is also one of the when Sanjay contacted me to talk about this situation, I said, well, you know what? Because he asked me that this situation is affecting you personally. So personally, no. But because I work with many friends, many fellow individuals living with HIV, I said, yes, this is affecting me in the personal level and my work also. And Tonio, you mentioned as a case, the case law is too much, and all the case managers are, I don't know what to do because I have to take care of 100 people calling me. So that happened to us also. Okay. So in summarizing this thing is, there is hope. Hopefully after June 30, we can continue with the whole thing. But right now in High Impacto, we are based in Broward, and that is the limitation because we work with PrEP and we do teleprep. So we have clients all over the Florida. But people living with HIV, you have to go to the doctor physically, right? At some point. So that part for people who are not close to our doctor, I'm not sure how we want to work. But for example, Tori, you are in Ocala and you have an appointment with our doctor and you have to come and that's it. Yeah, and the medication got to your home every month. So the point is, let's see, I can help you guys because I think so.
I had a question. I had a question regarding the cut because again, I'm still not happy with the answer from the state. So has y'all governor said anything about it?
You really want me to start cussing?
Don't bring that side of Kamaria out. I'm gonna let you have it, Battle.
So I think you're on mute, Kamaria.
No.
You're not on mute?
I can hear her.
I can hear her, yeah.
Sanjay.
I'm gonna push through and go ahead and respond.
Yeah.
So
I'll
long got to
summarize.
come back
Go ahead.
in.
No,
Uh-oh.
I can summarize in the chat too.
When we from the
Okay.
state, and she's going to come back in. Kamaria?
Yeah.
He's coming back in.
I can hear you, Kay.
Yes.
Well, I can't hear you, so that means the audience cannot hear you.
I can't hear you, Sanjay.
Let me see.
Oh, Lord, not this crap again. We were just doing just fine.
I'm gonna put my answer in the chat that I was gonna say.
Okay.
Sanjay, you can hear us?
Yeah, I can hear you. I just can't hear Kamaria.
You can hear us. We can't hear you.
Oh, Lord. Hold on. Hold on, y'all.
Yeah. Is
Tonio,
Sanjay-
can you hear me, Tonio?
I can.
All right. All right, Tori, I'm going to kick you to come back in. Emilio, can you hear me?
Yes, I can hear you. Can hear you me? Can you hear me?
I can hear you.
I am talking. Sanjay can hear me.
Yeah, Sanjay, can you hear him?
Yeah.
Uh-oh.
Can y'all hear me?
I can.
I can hear
Sanjay?
you too. Yeah.
Mm-hmm.
Sanjay,
Also, it seems like we're having some technical difficulties towards the end of the show now. So I just have to end it here. No, but other than that, hold on, let me see if I can make sure I hear myself. Hold on.
I want to say my answer so that people in the audience can hear it. So one of y'all can repeat me. That the governor has not said anything publicly, but we're eager for him to sign the stopgap measure. People keep forgetting there's still another step. The House and Senate voted to approve it. We still need the governor to sign it.
oh, yeah.
Wow.
I'm still trying to see.
So if you didn't hear Kamaria, she was sharing that the governor has not said anything in regards to these ADAP changes, but they are.
No, so
really
apparently I
looking
guess I can hear no
forward
one. So I have to
to-
end the stream, but I'm going to say thank y'all if y'all can read my lips. Thank y'all for coming on the show. And thank y'all for anyone that has watched the show so far up until the end, until, you know, all this tech stuff happened, basically. But I'll get it together the next show, basically. But again, thank y'all so much for tuning in.
Thank you. For those who hear me, that was a pleasure.